Good evening, everyone. My name's Rudy Page, and welcome once again to Overcoming Unseen Barriers. And this is a series of dialogues where we speak to members of the African and Caribbean communities here in the UK who have reached senior levels within the various institutions, whether it be from health, the police, media. And I'm so pleased today we've got Professor Frank CHINEGWUNDOH with us. Good evening, Frank. How are you?
Good evening, Rudy. I'm fine. Thank you very much.
Good to see you. Good to see you. So Frank, tell us a bit about yourself first.
Yes, well, I am a consultant urological surgeon. So that is a surgeon who specializes in disorders of the urinary system. I've been a consultant now for 25 years. I work at Barts Health NHS Trust, which is in East London, comprising Royal London Hospital, Barts, Newham, Whipps Cross and Mile End. In fact, it's the largest hospital group in the NHS in the UK. In addition to my NHS work, I also have a private practice. And in addition to that, I do a lot of medical legal work as well.
Excellent.
Yeah.
Yeah. So how did you get here then as a consultant?
Yes, well, it was a long journey, which basically took me up to age 35, 36, having left school at 18 before I reached that. I mean, going a few steps back, I was born in South London to Nigerian parents, and I was fortunate that they really valued education and impressed that upon myself and my three siblings. I went to a primary school in Balham called Ravenstone Primary School, and was fortunate enough to have some inspirational teachers, and in particular an inspirational headmaster who encouraged me at school, and which led me to go into grammar school. So I was one of those that went to a grammar school. I know there's a lot of arguments back and forth as to whether grammar schools are a good thing or not a good thing, but I went to what was a Catholic grammar school called Salesian College in Battersea. Met a lot of like-minded fellow pupils. Decided I wished to do medicine, which meant I went down a science pathway as opposed to an arts pathway. And I applied to various medical schools. I was accepted by one, which was St. George's Hospital Medical School in Tooting. So I went to Tooting, spent 5 years at medical school and qualified as a doctor many years ago now, in fact, 1984. And then when you qualify, you have to do a series of jobs, what we used to call house jobs, 6 months medicine, 6 months surgery, and then you're on your own. You then decide what it is you wish to do for a career. And for various reasons, surgery appealed to me. And so I applied for surgical jobs. And essentially, with each job, you ascend in seniority, which means you're able to do more. There's lots of really difficult exams to be taken and passed. You need to do research, you need to write learned articles, until eventually, so by now we're looking at age 35, you're in a position to apply for a consultant, which is the top of the hierarchy in the hospital system. And once you're a consultant, then you have a certain autonomy, and you can decide what it is you wish to subspecialize in. So I was a urologist. But as a consultant, you can choose what area you wish to focus on. In my case, I decided to major in prostate cancer. Okay. So that's kind of the pathway. It's a long journey from deciding to be a doctor at age 8 or 9 to qualifying and going through the ranks to become a consultant in your mid-30s.
Yes, certainly persistence being a key word.
Absolutely.
So what advice would you give to prospective surgeons?
Well, I mean, you've said the word already, persistence. You know, I can't say it's an easy path, but then nothing worth doing comes easy. If you're determined to do it, then you will. So the advice I give to people depends on what stage they're at. So if they're at school, I say, you know, study hard, get a good science background, choose the correct A levels, do your homework with regards to the entry requirements to medical school, um, take the exams that you have to do over and above the A levels. Now, if I'm talking to medical students, what I say to the medical students who've already gone past that hurdle is, sure, you have to work very hard. You have to look at opportunities to shine as a medical student, because once you graduate, it becomes very competitive if you want to get the jobs that are going to take you up to the next level. If I'm talking to a registrar, who is a surgical registrar, someone who is kind of mid training, what I say to them is that there are role models ahead of you who look like you, who have made it. You need to find a mentor if you can. You need to work hard. You need to persevere. You need to be confident in yourself. Things are a lot more meritocratic nowadays than they were in the 80s and the 90s. And if you're good, you will make it to the top as a consultant. And I know a great number of black consultants, not just in surgery but in other disciplines as well.
Okay, thanks for that. So you're involved in a number of voluntary sector organisations, and you've had numerous roles. Could you just give us an overview of that, of those activities?
Yes. So I guess the main one is a registered charity called Cancer Black Care.
Mm-hmm.
Cancer Black Care is a charity based in Brent, although we take inquiries and we take calls from all over the country. And what Cancer Black Care does is that it supports anyone, but its unique selling point is Black, Asian and minority ethnic cancer sufferers and their families. And support can take various forms. It can take the form of information as to your cancer. It can take the form of advocacy. It can take the form of going along with you to your hospital appointments to make sure that you understand what's going on. Our staff also help people with the benefit system and the welfare system, because people can get themselves into all kinds of difficulties because they can't work because they're having their cancer treatments, and they require support from the welfare state. And it's very, very difficult when you're grappling with the cancer and the treatments to also grapple with the whole welfare system. So we provide that level of support on a one-to-one basis. Also, people may require counselling to help them get to terms with what has befallen them. So Cancer Black Care is able to offer counselling. We also are at the table in some of the policy-making bodies. So, for example, we would sit on the Bowel Screening Advisory Committee. So when there's a discussion as to how best to get people to uptake their cancer screening opportunity, we would be able to advise them as perhaps the messages they might put out into our community. We also get involved with research. So various university departments may have a project that they want to involve Black cancer sufferers in, and so we would facilitate that. We also work in collaboration with other charities that are in the cancer space. We work closely with Macmillan, for example. We work with Prostate Cancer UK. We work with Tackle, which is a prostate cancer organisation. So I've been chairman since 1998. The charity started off in 1996. So I've been there a long time, trying to do what I can to improve the cancer experience of Black and Asian and minority ethnic cancer sufferers.
Yeah, that's great.
In addition to Cancer Black Care, I'm also a trustee of Tackle. Tackle is the National Federation of Prostate Cancer support groups. So there's about 90 odd prostate cancer support groups up and down the country, which meet on a regular basis and discuss issues that concern them, whether it's treatments, whether it's how to cope with the side effects of treatments, whether it's lobbying for nurse specialists in the area. And so I've been a trustee of and also the clinical lead of the advisory board for many years. So, but that's prostate cancer specific, as opposed to Cancer Black Care, which deals with all cancers.
All cancers.
Other roles in the voluntary sector, there is a social enterprise called the Reach Society. The Reach Society was set up over 10 years ago by a group of Black professional men with the ethos of acting as role models. So the younger people, particularly the younger males who had expressed a lack of role models, could see that there are professional Black men who are successful, and therefore it's possible for the youth to be the same. So I'm on the management committee of the Reach Society. And every year we put on a careers conference where, something like 1,500 young people and the parents come along, where they can interact with 70 plus Black professionals from all kinds of areas, whether it's the aerospace industry or HS2 or the police or the army or journalism or the BBC or medicine. There's a whole range of professionals that are there to give information and to encourage the youth that attend. Because of COVID this year, we've had to do that virtually. So in April, in the Easter holidays, the Reach Society is putting on a virtual careers conference to try and replicate what we've been doing face to face. So I would encourage the listeners to go onto the Reach Society website, reach as in reaching out, reaching forward, Reach Society website, and encourage anyone over the age of 13 to log on and register. It's a free conference. It's
Great.
tremendous value to all the participants.
Excellent.
More in medicine, I'm a director of the London Consultants Association. So these are consultants from whether medical or surgical. These are consultants, and we form an association to share good practice. So the London Consultants Association. And more recently, I've become a director of what we term the COL. COL, that's the Council of Leaders in the Black Community. So there are a group of organizations. Reach is one of them. RAFA is another. The Black Teachers is another. There's about 8 of these Black associations where we've formed the Council of Leaders, because we wish to be the voice of the community and be able to speak to power about issues that affect our communities. Yeah. So I've become a director of that as well. So quite busy in the voluntary sector.
Yeah, without a doubt. And you still have time to focus on health inequalities as well.
Yes, absolutely.
What is your interest in that? I mean, you've touched on it with your various charities, but I guess from a system perspective.
Well, I mean, there are so many health inequalities. I mean, it's a truism that African Caribbean patients suffer disproportionately with diabetes and with renal failure and with hypertension. And more recently, I learned that they have more gum disease than perhaps other ethnicities. And then quite apart from that, there are various disease-specific disparities. So, for example, if you're a Black male, you're over 2 times more likely to develop prostate cancer and indeed die from prostate cancer. And what's more, you get prostate cancer on average 5 years younger than our white counterparts. With breast cancer, again, Black women get breast cancer at a younger age. and more of them have the so-called triple negative breast cancer, which is a more aggressive form. And we know, because every year there is a national survey, that Black patients have a less good experience, a less good cancer experience within the NHS. And so there are a lot of inequalities in the system that we are trying to address to improve things for ourselves.
So generally speaking, what have been your thoughts around solutions?
Well, I mean, that's very wide ranging. I mean, on a individual disease level, we need to understand better why there are disproportionate effects.
As it relates to lifestyle, so is that the correlation with lifestyles and
Could
diet?
be lifestyle, yeah.
Diet, nutrition.
It could be lifestyle. It could be nutrition. It could be diets. It could be, the fact that Black people are more likely to be at the lower end of the socio-economic.
Then the environment as it relates to mental health and spiritual well-being, of course.
Absolutely, all these things play a role. And I think one of the other things not to be mentioned is what I term the powers that be. So the leadership in the NHS, both at government level and also on an individual hospital or trust organization level.
Yeah.
There is a glaring lack of diversity on hospital boards. And I've seen very little change over the last 25 years that I have been a consultant. And if you don't have diversity, you end up getting decisions made that don't necessarily take into account the needs of the populations. Yeah. So one of the things that really seriously needs to be addressed, and I know people are trying to do so, is to improve the diversity of the organizations, the boards that run our health service.
Yeah, and the challenge around that, because you're really talking about widening the talent pool, but having widened it, can we then ensure that those who have benefited from that understand there's some obligation then to keep the gates wide open.
Yeah, absolutely.
And to collaborate themselves. And COVID has shown us also to remember that they come from communities which really need to better understand how the system works. And
well, that's right.
Public confidence is so important. Trust and confidence.
Trust and confidence. And I think those of us who are from the community and kind of better understand how things work are in a good position to lend some confidence to the community. So, for example, I and several others have been involved in trying to get the message out about being vaccinated. There has been so-called hesitancy, whether that's the correct word or not is it's for discussion. But there has been some mistrust in the Black community and some reluctance in some quarters not to get vaccinated. And I know yourself and many others have been involved in trying to say to the community, this is in your interest. It's in your interest to make yourself as safe as you can.
And to be informed,
yes,
reassured, and also then make the choice for yourself to counter some of the misinformation. So I know that you've done a lot of work around that as well.
Yes, it does sadden me where there's so much misinformation out there, and at times people choose to listen to that rather than to the proper information. And so I think it's up to us to try and counteract the misinformation, because at the end of the day it's only to be to the detriment of our community.
Yeah.
One of the things that I think that I think we need to think about in terms of the leadership in the NHS is the concept of the Rooney Rule. The Rooney Rule, which comes from the States and in major sports in the States, and essentially what it means is that if you've opened up for applications for a senior level job, you are mandated to interview at least one person from an ethnic minority. Not
Yeah,
to say that they're going to get the job or they need to be given the job, but at least have them represented as an in with a chance of getting the job.
and
So I think we
that's
should
very true, because linked to that, of course, is the Workforce Race Equality Standard,
sure.
that has all the data, and you can easily match the progression through the grades as well. And the system clearly can identify those people who, given development support, mentoring, and those kind of opportunities that have generally been available, but not to people from African, Caribbean, and the wider diversity groups. And you touched on it earlier on, mentoring is so important, that people do realize as they're coming through the system, it's really important to get a mentor who can show them the way forward and help them to understand the environments that they're moving into.
Yes, yes. I think we can no longer say, as I was told many a times over the years, no one's applying. No black people are applying for these posts, or worse, they haven't got the skill set required, and that is just so blatantly not the case. It's they are there, but not given the opportunity, and not being shortlisted. And one of the things that happens is that when it comes to being seconded into a role and being given additional experience, I've seen a lot of black colleagues overlooked. So when it comes to interview, they're at a disadvantage because they can't say that they've been working at that level. So there is something, as you said, about developing people. If the health service is serious about diversity and inclusion, there's something about better developing the talents that's there.
Absolutely. And one of the important elements, I think, in the era where we are now, there's greater opportunity for staff to utilize the networks as vehicles for development, self and collective development. And that's hopefully, as we come out of the pandemic, people will realize it makes sense to collaborate with each other, access the development, access the mentorship support, so that they can, get themselves prepared, interview preparation sessions, and those kind of things really do help as well, and engage much more with the community from which they've come from as well. That certainly helps. And again, COVID has shown that we do need our clinicians from our community to have that, again, that trust and confidence with the community from whence they've come about the services, because the NHS belongs to all of us. It's the first line in the NHS constitution. It says the NHS belongs to all the people.
Yeah, absolutely.
Essential.
Yeah. I think this networking is so important. I've come across many people who've trying to do it alone.
Yes.
And I think it's so important to get that support. And just by talking to someone, they can put you onto a different track, or they can say, by the way, do you know of this course? And oh yeah. And then or the other thing that's very helpful, particularly in the medical career context, is to advance in your certain medical specialties. You need to publish learned papers. You need to do some research and publish articles. And it's much better if you collaborate with someone else. It kind of lightens the load of struggling.
Absolutely. And again, in this coming out the pandemic era, hopefully there will be some examples where the community that has had the disproportionate impact are writing up some of these lived experiences. I mean, there is work going on up in Birmingham, Beresford Dawkins Group, okay. Birmingham Solihull Mental Health Trust. They're doing some great work around that. So it does exist, but of course, we certainly need more. And you talk about senior roles, particularly in the non-executive on boards. I mean, one of the advantages of people as they come up through the system is to get on the boards of charities like you've mentioned earlier on, and actually learn those non-executive skills and to actually understand what it is to use influence and support as opposed to being executive. Because one of the challenges around doing senior appointments and senior special advisory appointments is that a lot of the time people haven't on their way up really taken the time to be involved and at that non-executive level. And, you know, we're all saying when we're mentoring people, but not only will you benefit the charity because you're bringing capacity and skills and insight that of course they wouldn't have, the nature of what they do, but also you would learn how to mentor others and to support others and to use influence without actually rolling up your sleeves. That's your day job. So when the time comes that you don't want to be executive anymore, you would have honed the kind of skills and critical thinking as it relates to how, you know, functions and how the system works. And that's important if we're gonna get more people on boards, more people as special advisors, more people getting roles on advisory groups and things like that.
I think that's vital. I think we do need to look at these non-executive positions. Not that they're easy to land at all, as I can attest to, but so I'm interested in what you say about that. But you know, but I think I'm more interested in the executive jobs. Because in my 25 years as a consultant, I've not seen a black executive at the senior at the trust board level. So
very rare.
I'm talking about, you know, chief executive, finance director, director of human resources, director of performance.
Yeah,
you know, not one in my organization.
I've met a couple.
Seen,
I've met a couple over the last 20 years.
Yeah, so it's rare. I've seen more non-execs, you know, that are black. Yeah, I've seen more non-execs, not huge numbers, but at least it's, you know, to me, it's not such a rarity.
Yeah, and there's
people who've come from, you know, usually financial backgrounds or business backgrounds, and therefore can bring a lot of that talent, and they're generally kind of a bit more senior. But I'd like to see someone on the executive board running our major hospitals.
Yeah,
and who looks like me. And
there are major programs within the hospital trust anyway. Some serious, the budgets are quite high. So it is, again, the workforce race equality standards.
Yes,
the evidence is there. We call it accountability by data. So it's about the will within the system.
Absolutely.
To do, you know, to do the right thing, and certainly would improve the morale within the system as well. So
yes, I think it would. And I think you would get better decision making.
Yeah, better decision making, and also this focus on inclusion is so important because what it also gives us is a positive work culture. Because the values of respect are really important, because it's about trusting colleagues, have to work together. You have to be willing to share information, to assist each other, because it's about improving the patient outcomes as well.
Yeah, absolutely. And, you know, if you look to the board, it'd be good to see yourself reflected there.
Yeah.
You know, which currently isn't the case in most NHS hospital boards.
Yeah. Persistence is the word again.
Persistence. Well, I've been persistent. I've been persistent for 25 years now. You know,
it's a generational challenge. Look at it that way.
It is a generational challenge. Yes, 25 years is a generation. You know, I wish things were further forward than when I first became a consultant in 1996. But you know, perhaps my children would carry the torch.
Exactly. Or your grandchildren.
Yes.
I think it's our grandchildren, actually, to be honest.
I suspect you're right.
Right. Frank, it's great to catch up with you.
And you, thank you.
And thanks for coming on Overcoming Unseen Barriers.
Thank you very much, and all the best for the rest of the series.
All right, thank you very much.
Yeah.
Goodbye.
Bye-bye.
Bye.